Welcome to the Medication Administration course. Administration of medication is a core role and responsibilities for every nurse. To ensure safe and effective drug therapy for patients, nurses should be familiar with the indications, dosages, and intended effects of prescribed drugs. Assess each patient before administering a drug. Have the knowledge and skills to be able to administer a drug capably, minimizing your patient's anxiety and maximizing the drug effectiveness. The goal of this lecture is to provide the KFU staff nurses, orientees, trainees and interns information on the critical processes involved in safely administering medications, optimizing patient safety, promote the quality use of medicines, and achieving the desired response to medication therapy. Objectives: identify policy, standards, and principles of medication administration. Define professional responsibilities related to administering medications. Assess the knowledge, skills, and attitude of the staff nurse in medication management. Identify types of orders, the components of a drug order, and demonstrate the ability to interpret a medication order. Perform the necessary patient assessment before, during, and after medication administration, and respond to assessment findings related to the administered medications that require further medical or nursing interventions. The other objectives are to describe the proper storage of non-controlled medication, controlled medication, refrigerated medication, and how to destroy non-controlled and controlled medication. Identify the guidelines for correct medications administration. Define route and list examples of the different routes of medication administration. Define the technique for different route and form of administering medication. Identify a medication error and how to report an error. Identify common causes of medication errors and how to report an error, and ways to prevent errors. Accurately calculate the dosage to be administered. The first topic that we will discuss is regarding the medication administration policy, standards, principles. The major policies related to medication administration are high-risk or high-alert medication, medication administration and charting, look-alike sound-alike medication, pharmacy abbreviations, medication order clarification. Please refer to the hospital intranet for other policies and procedures of the pharmacy department. High-alert medications are drugs that have a heightened risk of causing significant patient harm when they are used in error. Although mistakes may or may not be more common with these drugs, the consequences of an error are clearly more devastating to patients. The high-alert medications list includes injectable calcium, insulin preparation, anticoagulants, inotropic agents, muscle relaxants. Please refer to the hospital intranet for the complete list of high-alert medications on the hospital. LASA means look-alike sound-alike. Look-alike medications are medications in which the packaging is visually similar to another product or medication. Sound-alike medications are medications for which the generic or trade name of the product or medication sounds similar in the spoken or written word. LASA medication used tall man lettering is applicable. The following necessary precautions to avoid errors for both the high-alert medication and LASA medication should be implemented. Have the warning sticker or label to alert staffs. Double check, have a second licensed healthcare professional check the medication. Document the double checked in the patient's record. Minimizing the use of verbal and telephone orders. To avoid confusion among healthcare workers, do not abbreviate drug names when communication medical information and drug orders. Refer to the approved list of pharmacy abbreviations in the hospital intranet. The Joint Commission International Standards for the Medication Management and Use encompasses the system and processes that our organization uses to ensure safe and effective use of medications to our patients. There are a system and processes to safeguard the following. The organization and management complies with applicable laws and regulation. There is a clear process in the selection, procurement, prescribing, ordering, transcribing, storage, dispensing, and distribution of medications. There is a clear policy for the preparation and administration of medications, complementary medicines, nutritional products and contrast agents. There is a continuous monitoring of medical therapies and everything is well documented. When you give medications, regardless of the type of medication, there are some basic principles that you will always follow. The 6 basic principles that you will always follow are: general knowledge, legal and ethical, patient's rights, universal precautions, patient safety, rights of medication. The first principle, general knowledge. The primary nursing obligation is to do no harm to the patients, especially when administering medications. General knowledge of pharmacology is essential, including the sound and current knowledge of the medication. Medication certified staff must research each medication prior to administration and know the following about the medication: drug's name, use, action, and usual dose. Side or adverse effects classification. Contraindications. Drug interactions, nursing considerations, precautions, preparations, and treatments of overdose. In order to improve the staff's knowledge, many references that provide detailed and most current up-to-date information about medications are available to healthcare professionals. These references are valuable tools for learning. The hospital intranet also provide electronic references such as Micromedex and Neofax. The second principle is the legal and ethical consideration in giving medication. A law is a rule of conduct or action. The governments enact laws to maintain public safety, and this includes or are qualified, unauthorized to administer medication. Ethics is a standard of behavior. Moral values serve as the basis for ethical conduct. This includes ensuring privacy and confidentiality to protect patients. The legal implications of nursing practice relating to medication administration include the following: educational requirements of professionals authorized to administer medications. Before administering any medication, the nurse must have a current license to practice and require passage of a written test to confirm the knowledge and skills needed for medication calculation, preparation, and administration before granting approval to administer any medications. A licensed nurse is only accountable for the medications he administers. Nurses shall not delegate, assign, or allow unlicensed staff to administer medications to clients for whose direct care the nurse is responsible. In King Fahd Hospital of the University, staff may administer medications only when the following conditions are met. Staffs have completed the medication administration training course. Staffs have successfully completed the clinical requirement for medication administration course. The staff has successfully passed the medication online examination. Legal aspects about controlled substances. The hospitals in Saudi Arabia strictly follow laws, rules, and guidelines laid out by the Saudi Food and Drug Authority and Saudi Ministry of Health, as they apply to regulate the manufacture, procurement, storage, distribution, prescribing, and disposal of psychoactive medications, including narcotics, controlled, and psychotropic drugs. All medication administration complying with the Ministry of Health rules and regulations, and all narcotic or controlled drugs dispensed and administered. Detailed document according to the directives of Ministry of Health and Pharmacy Policy and Procedure of King Fahd Hospital of the University. Controlled and narcotic drug must be managed carefully, and an accurate inventory and dispensing record must be kept. In the hospital unit, or pharmacy, controlled drug must be kept in some sort of double-locked area. Each healthcare facility used a specialized form or electronic system for the use of controlled drugs. This is to monitor the usage. This controlled drug count verification should be strictly implemented. This form verifies the following: patient name, medication name, dose, time of administration, signature, personal identification number of the licensed nurse who administered it. Name of the prescribing person is also listed. To ensure that narcotic drugs are properly controlled, all count must correspond with documentation form. If there is a locked narcotics cabinet, 2 licensed nurses one going off duty and the other coming on duty. Review the documentation and count the number of remaining controlled medication. This assures the oncoming nurse that all the drugs are there. If there is a locked cabinet, the keys must be in the licensed nurse's possession at all times. Principle 3. Patient's rights. A patient has the following rights: to be informed of the medication's name, purpose, action, appropriate treatment alternatives, and potential undesired effects. To refuse a medication regardless of the consequences. To have a qualified nurses or physicians assess medication history, including allergies. Talk with the individual and explain what you are doing before you give medications. Answer any questions that the patient has. The right to make decisions. Help the individual to be as involved as possible in the process. Also part of the patient's rights: the right to courtesy, respect, dignity, responsiveness, and timely attention to health needs. The right to confidentiality, to be provided with privacy. To be properly advised of the experimental nature of medication therapy and to give written consent for its use. To receive labeled medications safely without discomfort in accordance with the rights of medication administration. To receive appropriate supportive therapy in relation to medication therapy. Not to receive unnecessary medications. Principle 4. Aspects of universal precaution. These are steps designed to protect oneself if the possibility of contact with anyone's blood or body fluids exists. Universal precautions are intended to supplement rather than replace recommendations for routine infection control, such as hand washing, and use of protective equipment such as gloves to prevent microbial contamination of hands.
Prevent injuries from needles or other sharp instruments by not recapping needles by hand, not bending, breaking, or manipulating needles by hand. Place all used disposable syringes and needles and other sharp items in a puncture-resistant sharps container for disposal. Locate the sharps container as close to the use area as is practical but still safe for the staffs. The most effective method to prevent and control the spread of disease is following the correct steps of proper hand washing and applying the 5 moments of hand washing all the time. Principle 5. Patient safety. Practicing the international patient safety goals in administering medication. Use at least 2 patient identifiers. Patient's name and medical record number should be checked before medication administration. The patient's room number nor bed tag should not be used whenever administering medications or providing any other treatments or procedures. Improve the effectiveness of communication among caregivers by using SBAR. For verbal or telephone orders, verify the complete order by having the person receiving the order repeat back for verbal orders and read back the complete order for telephone order. Standardize a list of abbreviations, acronyms, and symbols that are not to be used throughout the organization. Improve the safety of using medications. Take action to prevent errors involving the interchange of look-alike, sound-alike drugs. Label all medications, syringes, medicine cups in procedural settings. Implement a process for obtaining and documenting a complete list of the patient's current medications when the patient is admitted to the facility. This is part of the medication reconciliation process. Communicate a complete list of the patient's medications to the next provider of service when the patient is transferred to another setting. This is the other component of the medication reconciliation process. Principle 6. Rights of medication administration. Right patient. Check the 2 identifiers before administering the drug. Right drug. Check the drug name in the medication label, comparing it with the doctor's order and electronic medication administration record. Right route. Check the correct ordered route before medication administration. Right time. Make sure that you are administering the medication in a timely manner according to the doctor's order. Right dose. The correct dosage to be administered must be checked and to ensure that the right calculation is done before administration. Right assessment. Assess patient before administering the drug. Hold medication and refer to the physician for any unusual vital signs. Example: hold the ordered morphine if there is a decrease in the respiratory rate and inform the physician. Right documentation. Document properly in the electronic health record. Right evaluation. Check the effectiveness of the drug after administration. If there are any side effects or adverse effects of the drug, inform the physician immediately. Patient's right to refuse. Always remember that the patient has the right to refuse to take medication, and as a nurse, your role is to explain properly. What are the possible risks of not taking the drug? Patient's right education. Bear in mind that you need to educate before you medicate. You can avoid a serious mistake if you take special precautions to ensure that the correct medication is given to the correct patient, including the following. Prepare medication for one individual at a time. Give the medication to the individual as soon as you prepare it. Do not talk to others and ask them not to talk to you when you are giving medication. Do not stop to do something else in the middle of giving medications. Pay close attention at all times when you are giving medications. An important step in administering medication safely is being sure the medication is given to the right patient. To identify the client correctly, check 2 for safety. Always check at least 2 forms of identification before giving any medications. Compare the prescription label with the medication order and/or the EMAR with the patient's identification band. Make sure that they match. Check the medical record number on the identification ID band, as well as the patient's name. Compare the patient's name and record number on the medication package with the patient's name band. Ask the patient his or her name to ensure the patient's identification bracelet has the correct information. If they do not match, or if there is any doubt about whether you are giving the medication to right individual, stop. Ask question. In order to be sure that you are giving the right drug, nurse must do. Read the medication label carefully. Remember that some medications have more than one name, brand name, and at least one generic name. Read the medication order carefully. Make sure that the medication name on the order matches the medication name on the label. Read the medication mark carefully. Make sure that the medication name on the label, the medication order, and medication administration record match before giving the medication. Look at the medication. If there is anything different about the size, shape, or color of the medication, verify before you give it. Each time that you give a medication, you also need to remember to do the 3 checks. You must check when you remove the medication from the locked area in the Omnicell dispensing cabinet or medication cassette. Before you transfer medication, like pouring the medication in a medication cup or aspirating a medication from a vial to a syringe. Check the prescription label against the medication order to make sure that they match. Label immediately the medication cup or syringe where you transferred the medication to avoid confusion. After you pour the medication, but before you give it, check the prescription label against the medication log entry again to make sure that they match. Nurse must do the following to avoid a serious mistake and take special precautions to ensure the correct medication route. Pay close attention at all times when you are giving medications. Check the physician's orders and the MAR to verify the route by which the medication is to be given. Remember the 3 checks. Administering a medication by the wrong route, even though it is the correct medication, could be fatal. Check the order and appropriateness of the route ordered. If a prescriber's order neither does nor designates a route of administration, the nurse consult the prescriber. Likewise, if the specified route is not recommended, the nurse should alert the prescriber immediately. The nurse must know why a medication is ordered for certain times of the day or time schedule can be altered. King Fahd Hospital of the University has a standard time schedule for medications ordered. Medication that must act at certain times are given priority. Example, insulin should be given at a precise interval before a meal. Always administer drugs at specified times. Check administer drugs that are affected by foods before meals. Drug administration may be adjusted to fit schedule of patient activities and diagnostic procedures. Antibiotics should be administered at even intervals.
As currently practiced, timing of medication should be set as follows. Please refer to the hospital intranet policy regarding the standard timing of medication administration. To ensure the right dose, nurse must double-check that the amount of medication supplied matches the amount needed for the ordered dose. Always listen to the patient. If he or she questions the medication's color, number of tablets being given, or administration route, recheck the MAR, order, and medication label before giving the medication. Calculate and check drug dose accurately.
In the case of liquid medications, you need to know the strength of the medication in each liquid measure. The dose equals the strength of the medication multiplied by the amount. Look at the sample label. Prior to the administration of medications, nurses assess the patient and the appropriateness of the prescribed medication in their particular situation. Nurses should consider the patient's age, weight, vital signs, laboratory results. In addition, nurses check for allergies, sensitivities, previous adverse reactions, possible interactions with other medication, and any foods that are contraindicated or decrease absorption. Proper documentation communicates to other members of the healthcare team which medications were administered and when. To assure safe and accurate documentation of medication administration, remember the W's when documenting medication administration on the patient chart. When is the specific time of administration? Why the medication is given include assessment, symptoms or complaints, even considering lab values. What medication was given, what dose, what route? Where is the site that the medication was administered? Was the med tolerated, and was it helpful to the patient? Please refer to the nursing department's policy on how to effectively document medication administration using the following techniques. This will assure that your documentation is clear, concise, and easily understood. Nurses evaluate patient outcomes following medication administration and take appropriate steps for follow-up. Is the drug having the positive effect expected? Note if the desired outcome manifests in the patient. Nurses should keep in mind that patients have the right to refuse their medications. However, they have the duty to know the reason why they refuse their medication and inform the physician to deal with it. Patient teaching is also an important safety consideration for medication administration. Nurses should teach patients the necessary information concerning medications they receive and document it accordingly in the multidisciplinary patient and family education form or in the system. The following are the responsibilities which the nurses must be aware of whenever administering drugs. As professional nurses, are duty-bound to carry out these responsibilities. Check for the completeness of the prescribed medication in the physician order sheet with the right patient's name, right medication, right dosage, right time, frequency, right route. and must include also the time, date, prescriber's name, signature, and ID number. The following are the responsibilities before medication administration. Check for the complete medication order from the authorized prescriber. For any doubts in dose calculations. Verifies doctor's order with proper medication name, date, route, and dosage. Check the doctor's order with the medication administration record. Check for allergies, vital signs, laboratory data, or patient's behavior. Know about each of the medications you will administer to the person before you give. Ensure that all medication details for every patient is being handed over to the next shift. At the beginning of the shift, check the medication electronic administration record and Cardex for medication times and medication changes. 2 nurses should count controlled drug at the start of the shift to ensure that all controlled drugs are accounted for. Notify head nurse or charge nurse for any new medication orders or changes to the existing orders before preparing the medication. Responsibilities when you are preparing medication. Check medication order with physician's orders and medication administration record to make sure that the medication has not been given. Use the 5 rights when comparing information: right patient, right time, right dose, right drug, and right route. Follow the 3 checks of label on drug container and include the checking of expiration date on drug label. Recheck drug calculation with another nurse, especially for high alert medications. Verify doses of drugs that are potentially toxic with another nurse or pharmacist. Wash your hands. Assemble all appropriate equipment, medication cups, crusher, and other equipment needed. Allow no distractions when you are preparing medication. When preparing the medications, do not use the following: medications from unmarked container with illegible labels. Medications that are cloudy or have changed of color. Medications that have sediment at the bottom unless the medication requires shaking before use. Medication in the solution or suspension should be shaken well to ensure homogeneity before a quantity is removed from the container in filling a drug order. Make sure those medications, especially liquids, are in the correct consistency for administration to that patient. Dilute drugs that irritate gastric mucosa or give with meals. Do not use one patient's medication for another patient. Medications are the property of the patient whose name is on the label. Sign for controlled drugs on the receipt and disposition record when you remove them from the container. Lock the medication cabinet before walking away.
Responsibilities when you administer medication. Administer only those drugs that you have prepared. Identify the patient by using the 2 identifiers and check ID band. Assist patient to appropriate position. Perform any pre-administration task specific to the medication you are going to administer. Before you give the patient the medications, like checking pulse or blood pressure, inform and explain the patient of what you are going to do and give. Follow correct techniques for administering that dosage form or that route of medication. Observe the patient as you administer any type of medication. Also remember to stay with patient until all medications are taken and make sure the patient has swallowed oral medication. If a patient vomits after taking an oral medication, report to the charge nurse and physician. Remember not to administer medications when patient has a change of condition or level of consciousness. The label of the medication can't be read. The patient refuses. Any of the 5 rights are missing. Signed order is not present.
Infants receive no more than 1 milliliter of solution by IM at one site, and no more than 1 milliliter subcutaneously. Give drugs last to patient who need extra assistance. Discard needles and syringes in appropriate containers. Follow appropriate drug disposal based on hospital policy. Discard unused solutions from ampoules. Store appropriately and used solutions from open vials. Write date, time opened and initials on label. Avoid contamination of one's own skin or inhalation to minimize chances of allergy. Responsibilities after you administer medication. Wash hands informed about what you have observed about the patient's response to the medication. Notify the charge nurse and physician immediately if you suspect the patient is experiencing an allergic effect from a medication. Notify the charge nurse and physician if you are not able to give a medication as ordered. Complete documentation for medication given. Records any unusual observations in patient's record and report to the charge nurse and attending physician. Record effectiveness and results of medication given, especially PRN meds, and complete the documentation on the electronic medication administration record. You are responsible for ensuring the security of medication. Never leave the medication cabinet unlocked. Never leave medication keys out for access by persons in or any staff that are not currently certified. Clean up the medication area as necessary.
Welcome to the Module 2 of the Medication Administration course. This focus on the knowledge of medication administration, on how medication works in the body, the factors that affects the drug action, the classification of the drug, and the different types of medication orders. Medications can be referred to by two names: a generic name and one or more trade names. Generic name signifies the medication's chemical derivation. However, this may not always be the case. At times generic names are either determined by the company that first developed the drug. Generic names are written beginning with a lowercase, small letter. Trade name is a name chosen by a pharmaceutical company for the purposes of marketing or to identify the company responsible for manufacturing the drug. The trade name may also represent some property of the drug. Trade names usually begin with a capital letter and may be followed by a trademark.
The drug is any substance taken into or applied to the body for the purpose of altering the body's biochemical functions and thus its physiological processes is affected. Medications are used to treat and cure illnesses, aid in diagnosis like the contrast agent. Controlled medication is medication that the Drug Enforcement Agency considers to be a depressant or a stimulant with potential for abuse or addiction. Non-controlled medication is medication that is not considered to be a depressant or a stimulant and not considered addictive or with a potential for abuse. The drug's special considerations. There may be specific instructions that must be followed when administering a particular medication. Reference books identify any of these. For example, to administer with food or wait daily. The drug's action. The action describes how the drug will work in the body. Once the drug enters the body and is distributed, it will produce an effect on the body. These effects may include individual effect, desired effect, no effect, side effect or adverse effect, and allergic effect. Individual effect. Medication enters the body and changes occur at the cellular level, with each person responding uniquely to any given medication. Therefore, patients on the same medication may not respond in the same manner. Desired effects. Therapeutic or intended effect. The medication acted in the body in a manner that it was intended. Medications are given or prescribed for many reasons. Some examples include promote health. Example, nutritional supplement. Eliminate illness. Example, antibiotics. Control a disease. Example, oral hypoglycemic. Reduce symptoms related to illness. Example, cough suppressant, aspirin. Alter behavior. Example, anti-anxiety, antidepressant, antipsychotic. The side effect is the action of a medication that is other than its desired effect. It is undesirable, but commonly predictable. An adverse effect is a response that is neither intended nor is expected in normal use and which causes significant, sometimes life-threatening illness. Please check the following examples of unwanted effects and the serious adverse effects. Anaphylaxis for anaphylactic or allergic reaction shock. This is a serious allergic reaction that can be life-threatening. Anaphylactic shock is a generalized systemic reaction, frequently fatal, which usually occurs within minutes after contact with an allergen. Signs of anaphylaxis for anaphylactic shock include skin reaction, hives, redness or flushing, sense of warmth, itching and skin rash, difficulty breathing, chest tightness, wheezing, throat tightness, fainting, lightheadedness or loss of consciousness due to drastic decrease in blood pressure, rapid or irregular heartbeat, swelling of face, tongue, lips, throat, hands, or feet. Medication toxicity. This is also an undesired, harmful effect that results from an increased blood level of the medication beyond its therapeutic level. Administering the medication into large dose, or via the wrong route, can lead to drug toxicity. Paradoxical effect. This patient's response is opposite to that which is desired. For example, the client may become extremely agitated and restless in response to a sedative given for sleep. Potentiation effect. Two drugs may potentiate each other. That is, the effects of the two medications are greater when added together. Potentiation multiplies the effects of the drugs. This can become a very dangerous situation. A prescription medication orders is a written formula for preparing and giving a medication. As stated, only certain healthcare providers are licensed to write prescriptions. A pharmacist is the only person qualified and licensed to prepare medication, especially in the sterile field and under a laminar flow. In a healthcare facility, the prescription written on the physician's order sheet contained in the patient file or entered into the computer by the physician is sent to the hospital pharmacy for preparation. The orders contain the start time and date. The medication is to be given for the specified period stated in the order or until the order changes or is discontinued. Nurses need to be aware of medication terminology, symbols, and abbreviations used in prescription. The medical profession utilizes many abbreviations when communicating through notes, prescriptions, and orders. You are responsible for knowing some of the more frequently used abbreviations according to the approved hospital list. Types of medication order. There are several ways that a medication may be ordered. Types include stat, single order, standing order, renewal order, PRN order, verbal order and telephone order, electronic order, prescribed order. The stat order. This medication must be given immediately and can be override in the omnisul cabinet. However, if the stat medication will be dispensed from the pharmacy, a turnaround time of within 30 minutes must be considered. A physician has responsibility for not overusing stat as an order. A single order is to be given only once and only at the specified time. The standing order. Standing medication orders to be instilled on all of their admissions or on all of their patients with a certain diagnosis. The physician may also have a standing order on the procedure that should be carried out on certain treatments. Specified time may be used for a scheduled surgery or other procedure when the medication needs to take effect before the procedure starts. Electronic order is a process of electronic entry of medication. These orders are communicated over the computer network to the medical staff or to the departments responsible for fulfilling the order. PRN order. Order permits the nurse to use his judgment to assess when the patient needs the medication. Prescribed order. Medications that will be taken outside the hospital setting. The renewal order for a certain medication that needs to be reviewed, renewed, and must be written and signed by the physician before the nurse can continue to administer the medication. Examples. All orders for controlled substances are required a review every day. All orders for warfarin, anticoagulants require a review every day after checking INR and PDD. Antibiotic orders must be reviewed every 7 days. In emergencies, physicians and other primary care providers may give medication orders, either verbal or by telephone. As a licensed nurse, to take verbal orders, Be sure to repeat order back to the healthcare provider and to document accordingly. For the telephone order, it is important to document that the order was taken by a nurse and that it was read back to the provider before administration. In the clarification of medication order, nurses are responsible for carrying out orders as given. The nurse cannot make any changes if there is any reason to question an order, if the handwriting is not legible or if it is confusing. Clarify it with the healthcare provider who has ordered the medication. Do not administer any medication that was not clarified to the ordering physician to avoid errors. Medications can break down if not stored properly, affect body function, and can be harmful if not taken properly or if taken by someone other than the person for whom they were prescribed. There are 3 important factors which must be met when storing medication: environmental conditions, security and access, convenience. Medications are chemicals. Like all chemicals, they may undergo chemical reactions or breakdown, thus deactivating the drug. Conditions which promote chemical decomposition of most drugs include heat, moisture, light, air, and time. How much each of these factors affects the medication depends on the specific chemical. Therefore, most medications should be stored in a cool room temperature, dry, and dark place, unless otherwise directed. If a medication requires special storage, the pharmacist should inform you of this, and there will be instructions regarding special storage on the pharmacy label. The following guidelines should be followed. Medications should be locked away from children and others who are unauthorized. Store medications in their original containers. Medication should be kept dry and cool areas. Store away from heat and direct sunlight. Do not let liquid medications freeze. Always maintain the approved temperature range of the medication refrigerator in your units. Return to pharmacy all unused or outdated medications. Always keep the lid on the medication container tightly closed. Never mix different medications together in one container. The best way to dispose of unneeded medications is to return it to the pharmacy. The policy states the proper disposal of medications. Any remaining amount of a narcotic ampoule after withdrawing the required dose should be disposed of in the ward by flushing into the sink with running water by staff nurse who is handling the narcotics at that time, accompanied by the witness register nurse. Any medication that is disposed of will need to be documented properly. The dispensing for medication in the hospital is through the Omnicell dispensing cabinet. However, in most units with no Omnicell, the medication supply that will be provided will be only a 24-hour supply of medication for each patient to prevent duplication and to track down the usage and consumption of medication. All leftover medication, outdated or discontinued medication must be returned to the pharmacy during the drop-off time. All these medications should never be kept in the units to avoid medication errors. Medications of discharged patients should never be used for other patients. These things tend to lead to medication errors. Dispose syringes and sharps according to infection control policies. Comply with documentation policies on medication administration system in a safe and effective manner. Ensure timely, accurate documentation of all medications they administer, and related client care and outcomes of care. Skill and safe medication administration practice. Drug therapy can be administered by several different routes or methods. These routes of administration require different preparations or forms of a drug. Most drugs are available from the drug manufacturer in multiple forms. The selection of the route and form is based on the interaction between core drug knowledge and core patient variables. The skills and safe medication administration practice will be applied and supervised by your preceptors during the completion of your clinical requirements for medication administration. Aside from applying the skill and safe medication administration practice through the completion of the clinical requirements for medication administration, the evaluation of the staff's knowledge, skills, and proper attitude and approach will be checked by the clinical resource nurse of your unit to ensure that you are competent in giving medications, especially in dealing with parenteral administration methods. Intravenous IV medication administration refers to the process of giving medication directly into a patient's vein. Methods of administering IV medication may include IV push or rapid injection into the vein using a syringe, intermittently over a specific amount of time using an IV secondary line, continuously mixed in the main IV solution. It can be given through peripheral line or saline IV lock. Direct IV through an implanted vascular access port, example is the Porthall catheter, or through a central line. Saline heparin lock is a peripheral IV device. It is a short IV line that has been locked off to prevent venous fluid from flowing out. It is primarily used to access a vein for intermittent IV drug therapy. IV drugs may not be compatible with certain IV fluids or other drugs. Drug incompatibility is a true risk to the patient because it can cause crystallization of the medication that may at the least clog the IV line or at the worst have an embolus effect on the patient. The healthcare professional must check compatibility warnings that are included in IV drug administration guidelines. The line must be flushed with saline before and after giving medications IV to avoid contact of incompatible solutions or medications. Administration of medications through piggyback. Medications are given at scheduled intervals, using a separate pre-mixed IV bag, and additional IV tubing connected to an existing IV infusion. This method of administration is referred to as IV piggyback or a superimposed infusion. It may also be called a small volume parenteral delivery system, the partial fill, or a mini bottle. The patient receiving the piggyback administration of medication also has a primary IV, which is usually one of the more commonly ordered IV solutions. The small bottle delivery system may also be delivered into a saline lock. Administration of medications through volume-controlled infusion. Another method of medication administration is with the volume controller. The solution to be used to dilute the medication is supplied in a small bag. This bag is hung on an IV pole and a volume control device, such as the Buretrol, is hung below it. After priming the tubing, the ordered amount of diluent is run into the volume control chamber, usually from 25 to 250 milliliter. Then, the prescribed medication is injected into the intake port of the chamber. This infusion is often given piggyback. The procedures for running this infusion are the same as for any other infusion. The rate of administration must be carefully controlled. In this way, a very exact amount of IV fluid and medication is administered. Administration of medications by IV bolus or push. This injection is given in a short period of time and is not intermittent. The IV push only requires a small amount of fluid. Thus, it is often recommended for a client who is at risk for fluid overload. Refer to policies regarding which medications may be given by IV push. IV push only during emergency situations. The medication error is any violation to the 10 rights of medication administration. Example: medication given to a wrong patient is a violation of international patient safety goal in identifying the correct or right patient. Make sure to monitor the patient for any untoward signs. Inform the charge nurse and physician. Then, complete the EOVR. All nurses should be familiar regarding the drug calculation formula. The desired dose or doctor's order divided by the stock dose or available dose, multiplied by the quantity or volume. Try to solve the example. If the doctor's order is to give a 50 mg of diclofenac intramuscularly stat, how many milliliters will you administer to your patient? Try again to solve the example. Practice makes it perfect. If the doctor orders to give the 3 milliliters of elixir per kilograms, and the weight of the patient is 6 kilograms, how many milliliters will you give to your patient? You are doing great. Now let us try a more complicated drug calculation. If the doctor orders to administer 5 microgram per kilograms per minute of dopamine, and the stock dose is 400 milligrams diluted in 100 milliliters of the normal saline, the weight of the patient is 60 kilograms. How many will you give to your patient? Try again. Practice makes it perfect. If the doctor orders to administer 3 microgram per kilograms per minute, and the stock dose is 500 milligrams diluted in 100 milliliters of the normal saline, the weight of the patient is 175 pounds. How many will you give to your patient? Thank you for watching. Hoping that you enjoyed this medication administration course, and you will be able to apply what you have learned in the nursing units. In order to provide a quality care and safe practice in administering medications to your patients,